"Oh my God, my mouth's bleeding! Quick, rush me to the emergency dentist! I'm gonna die, I'm freaking out, make it stop! I was only brushing my teeth and now there's all this blood in the sink, help! Help me call the paramedics!" "Yeah, right," said no one ever. Because bleeding gums are normal, aren't they? Da-da! Computer says no, incorrect, wrong, it's not normal. And I'm going to tell you why. Bleeding gums might be common. It might be a common thing, but that doesn't make it normal or okay. And by rights, you should be freaking out if your gums are bleeding. I mean, if you brush and you do that thing between your teeth, what's that thing called again? Yes, flossing, but you do it so infrequently, you can't remember what it is. If you washed your hands and blood started dripping from under your fingernails, would you be like, "Oh yeah, that's just normal, it's nothing to worry about"? Or would you run screaming from the bathroom trying to make it stop? Well, of course you'd want to know what the heck was happening and get it sorted. So why don't you have the same level of concern when it comes to your gums? A little blood in the sink when you clean your teeth isn't normal. It's actually a sign of disease, infection, and inflammation. It can also be a warning that you're at risk of things like heart disease, high blood pressure, cancers, dementia, and strokes. That blood could be telling you that you have a nutritional deficiency or even a really serious underlying health problem like diabetes or leukemia. Now, I'm not trying to freak you out, but I'm trying to get you to see that bleeding gums isn't normal. So, I bet now you're wondering what you can do about it and how you can make it go away. Well, luckily, I'm going to answer that for you later on, but first, let's talk about why your gums bleed. Listen, if your gums bleed, because bleeding gums is not normal, healthy gums should never bleed, when you're brushing or flossing, if they bleed, we need to first figure out why. And there are usually two main reasons that you have bleeding gums. One is gingivitis or periodontal disease, and the other is because of a systemic health condition or an underlying total health problem. Now, I can't even count the number of times patients have said to me, "Oh, my gums bleed, but it's normal." Come on. If your hand bled after you wash, would you just casually mention it to your doctor? "Oh, by the way, I notice my hand bleeds all the time, but yeah, that's just normal, right?" Your gums should not be bleeding. So I always tell my patients, come on, first we need to figure out why they're bleeding, and then we're going to be able to figure out how to stop that from happening. Quite simply, your gums bleed because they are unhealthy or because you are. Now, some people's gums only bleed when they floss. Other with more inflamed gums might see bleeding every time they brush, or even if they touch their gums or when they're eating. Now, the most common reason for bleeding gums is simply because of poor home oral hygiene care. You're just not keeping your teeth clean enough, and you're probably having too much sugar and processed carbs. Plaque starts to build up on your teeth, and your body sees that plaque bacteria that shouldn't be there. And if it's been hanging out on your gums for too long, your immune system starts rushing antibodies and white blood cells from your bloodstream directly to your gums to combat and deal with that plaque bacteria. And it's this immune response in combination with the bacteria that causes inflammation and then the bleeding of the gums. Bleeding gums are telling you things are out of whack. So with some proper brushing and flossing, you can get this under control, but it's also critical in preventing the gums from bleeding in the first place. You do actually need to brush your gums. You need to massage them with your toothbrush and when you're flossing. And if you don't, it's only a matter of time before your gums are going to start to bleed. So you need to be making sure you're brushing and flossing daily. It's like working out. The more you work out, the less it hurts and the fitter you get. The same goes for your gums. The more you stimulate and massage the gums, the less tenderness you will feel. So make sure you brush and floss correctly as well as for long enough. And I'll post some links to some videos about that for you. This kind of answers why your gums bleed and partly how to stop it. But what if your gum health is really bad, or there are other things going on? Because if that's the case, no amount of brushing, flossing, mouthwashing or oil pulling is going to fix that on its own. If you've tried brushing and flossing more and your gums keep bleeding, then look, you really do need to make a dentist appointment, and then we can work out what's going on and how to treat it for you and with you. Yes, with you, we work together. Most likely you're going to need a professional cleaning and maybe even a deep clean called gum therapy. But in the majority of cases where there's bleeding gums, the main cause is gingivitis, which means inflammation of your gums. If your gums are inflamed, they become swollen and they bleed more easily because they're full of blood vessels, and they bleed far more easier because of the plaque bacteria sitting on and under your gums, which is causing inflammation. Now, the good news is gingivitis is reversible, and with proper dental cleaning and better home care, those bleeding gums are going to stop, which is great. However, if you don't reverse gingivitis, if it is left unattended and you don't deal with those bleeding gums, it is going to progress into a more advanced stage of periodontal disease called periodontitis, which is inflammation of the gums and the bone that hold your teeth in. At this point, the bacteria have snuck their way under and way below the gum line, underneath your gums, and that can lead to bone loss. And we don't want that, because the bone is what holds your teeth in. So it's super important to visit your dentist and find out why your gums are bleeding. If it's gingivitis, then you can work hard at home, keep the gums clean. And if it's periodontitis, then you also need to work hard at home, but you need to get that deep cleaning done, and you'll need to then see your dentist regularly, about every 3 months, to help prevent the gums from flaring up again. Now, earlier, I said there were 2 main reasons your gums bleed, and the second reason is because of systemic health problems. There are a few things that can make your gums bleed easily. Well, firstly, there's diabetes and high blood sugars. That's linked to bleeding gums. And so are things like deficiency of iron, vitamin C, zinc, vitamin B12, and vitamin D. Diabetes makes you more prone to infections, and that means your gums will bleed more easily if they aren't kept really clean. When I see patients and their gums don't respond to the treatment, I consider that there must be some systemic issue or a deficiency, and I encourage blood tests and for them to go see a doctor. Now, I don't want you to freak out and panic. Your gums aren't going to get better and heal overnight. It may take a couple of weeks for your new improved oral hygiene routine to get things back on track. So don't give up, don't freak out and think you must be diabetic or that there's something wrong with you. Give it time, and if after a couple of weeks of better care, things aren't back on track, then that's when we start looking for those underlying reasons. But don't go it alone. First, go see the dentist and have them remove any hardened plaque called tartar, because if there's tartar on your teeth, you can brush and brush and brush and you will just not get rid of it, and your gums won't get better. And often there can be tartar below the gums as well, and that tartar needs to be professionally removed, and then you can focus on maintaining clean teeth and healthy gums once things are back on track. Now, there is one exception to the rule when it comes to bleeding gums, and that's if you're a smoker. Now, when you smoke, your mouth not bleed even if it's infected, and that's because you get changes in the blood supply to your mouth that smoking causes. So if you smoke, please get regular gum exams, because you could have periodontal disease happening without you even knowing about it, because you don't get that bleeding. If you do see blood in the sink, No, it's not normal, and it's your gums telling you they need better care or your body letting you know that something is out of balance. And if you brush and floss well, your gums shouldn't bleed. And if they do, then you're going to want to watch this video.